Hello, everyone. Again, it's Melissa Faulkner here with Infinx. We are so happy that you are able to join us for this week's session to talk about next generation solutions for eligibility and prior auth. Today, my guest is Aakarsh Sethi, the Senior Product Manager here at Infinx. Aakarsh, tell everyone hello.
Hey everyone, happy to be here.
Great. Thanks so much again. As usual, just as a reminder, you all can submit any questions and we will get to those in the conversation. Feel free to put anything in the chat in the Q&A. So we will get started. So Aakarsh, talk to us about the current challenges and pain points related to eligibility and prior authorization in the healthcare industry.
Sure, I think there's a lot of challenges and pain points within this sector, all really augmented by the staffing shortages caused by the aftermath of the pandemic, right? Which is affecting various industries, but also healthcare, right? In a very deleterious way. Now, what are these challenges? I think these challenges are that a lot of these administrative processes in patient access, starting with eligibility benefits, but getting to the big monster that's prior authorization, are so manually intensive and time consuming, right? And on top of that, it's your resources aren't optimized, right? Because you're using resources that could be focused on patient care, and they're now performing these administrative tasks. So there's not only is there a high manual cost, there's also a large opportunity cost associated with it, which is less attention to patients and compromising patient experience and patient care. So those of you who are familiar with this process know that this process, before new technology vendors came in, was highly manual. It involves people going onto web portals, or worse, picking up phones and calling payers and then staying on the line for a long period of time and then just waiting for responses from the payer, right? That's true in eligibility, to get a patient's eligibility benefits, also true in prior auth, and it goes one step further in prior auths, because you don't just get a response, you have to keep following up and keep tracking on the status of that authorization. So I think that's the main pain point here, but there's other pain points surrounding this as well, which is, knowing even if that prior authorization is going to be approved, is somewhat of a guesswork at this point, because there's so many payers, so many benefit managers. Each one of them has their own list of guidelines as to what requires prior authorization, what constitutes medical necessity. And it's not very clear in terms of, hey, XYZ is required, you meet the XYZ criteria, you get approved, right? And to some extent, it's intentionally, I believe, right? The next thing is denials, downstream denials on claims because of prior authorizations not being done or not verifying patients' eligibility benefits upstream. So I think two of the biggest causes for claim denials are these two front-end patient access processes. Then we can talk about several other things like, healthcare providers compromising cash flow when they don't collect upfront, right? When they're not doing point of care collections, by not knowing patients' eligibility, not knowing their specific benefits, and then not knowing patients' estimate. They just end up sending them a bill later on, and the collection rates really drop when you're not collecting upfront. So again, a plethora of challenges within this space, and just traditionally a very manual solution deployed for these challenges.
Yeah, I know a lot of us, that have been in the industry for a really long time remember doing the binder notes, filling out the forms, mailing things, or even before a fax machine was out there. So it had all that manual intervention that we still have to do, and still even today, of some of that lack of technology with certain payers. What are some of the key limitations with eligibility and prior authorization systems?
Yeah, I think let's talk about, what are these what are the solutions in place, right, for some of these challenges? I think the systems in place, what capabilities they have, and what have traditionally been the vendor solutions out there. So there are EMRs, EHRs that providers have that have some sort of capability to do electronic eligibility checks. And traditionally, vendors within the space use the same technology, and I'm going to talk about what that is. But I think it's important to segment them and talk about eligibility separately from prior authorization. So let's talk about eligibility and benefits first. I think traditionally, the automated solution within the space has to do with the EDI 270, 271 standard, which clearinghouses facilitate, where clearinghouses have relationships with payers and they can electronically request eligibility benefit details and get the response from players, and then they leverage the ANSI X12 EDI 270 271 standard to do so. This is the technology that is equipped in some EMRs, EHRs, practice management systems as well. Now, there's a lot of drawbacks with this technology, right? I think it is good. It is very good in verifying eligibility, purely telling you whether your patient has active coverage or not for a high percentage of cases, not all. There's always, or from time and again, there's network issues. Some payers don't respond at a given time. But I think 70 to 80% of the times, you will know at least whether the patient has an active coverage or not. Where this solution falls back is on the benefit side of things, right? So a lot of times you will be able to know whether the patient has an active coverage or not, but you will not get all the benefits you're looking for. Maybe you know what the deductible is, but you will not get information on the out-of-pocket remaining or the copay or co-insurance, which is very critical to know the patient's out-of-pocket expenditure, right? And we see that all the time when we use clearinghouses, right? You get, patient is eligible, the deductible remaining, the out-of-pocket remaining, but you don't know what the copay or co-insurance is. You don't get that information. So that is a struggle. The other one is when you look at different specialties, right? I think radiology is a pretty straightforward specialty, right? Where you need deductibles, out-of-pockets, copay, co-insurances, and you're good. But when you look at other specialties like orthopedics or oncology, when you're doing, say, physical therapy, you want to know how many services are covered, what's the limit of the services. If you want to know, is a referral required? These are things, we call them non-standard benefits to the 270, 271 standard, because this information you will almost never receive with the clearinghouses, right? And again, these are critical to your function. So even though you can use a solution and you get, some of your benefits, if you're picking up the phone to get the remainder of the benefits, it's almost as good as doing it for the entire case, right? So you don't really get the value unless something in the eligibility benefit space can take care of the entire transaction of the case. So I think there's certainly limitations to existing technology, which is the 270, 271. On the prior auth side of things, there is a commensurate standard called the EDI 278, but it's really nascent and primitive. In fact, there's barely any utilization of that standard, right? So there are some vendors traditionally that have come in and have tried to solve the prior authorization problem by trying to automate all of this. But I think to some extent that is a fool's errand, because what they do is, because there is no connectivity like a clearinghouse that can connect to all the pairs, prior auth solution vendors typically have tried to just establish relationships with one or two payers where they've managed to get some sort of automation, but then they just kick back the rest to customers, right? So large volume just gets kicked back, and you see that you've done your implementations, you've worked with this vendor, but you're getting a fraction or margin of the value that you thought you would get.
Yeah, I know with doing the eligibility and the, patient pay estimate is really big when it comes into, especially for radiology. And we know it's subject to change, right? Because every day a claim is adjudicated, it's going to change your estimate. But I think
Mhm.
it's really important as us as patients, before we go in for surgery, before we go into the MRI or whatever, we know what we're suggested to pay for that service. And again, it's that collection of cash up front. I think it's really important for our patients, and for our physicians. Looks like we have a question that comes in. We have, what unique challenges do you notice in the hospitals and health systems having, and how are we able to support them? I know we've got a full list of other ones, but I wanted to make sure that we got that from our audience.
Sure. So I think the question says, what are the unique challenges that hospitals and health systems have, and how are we able to support them? I think, based on the typical drawbacks of solutions in the market, we're seeing that our customers, typically healthcare providers, whether they're large hospital systems, whether they're physician groups, whether they're outpatient centers, ambulatory surgical centers, they have typically similar challenges in terms of their experiences with different technology solution vendors when they do go that route, right? In terms of the limitations of the eligibility and the prior auth solutions. But I think another challenge a lot of these entities face when working with vendors is problem of interoperability, right? Which is, you can have a solution that probably adds value to you, but if that means you have to go onto another portal and re-enter all that order information and then have to key in that information back into your EMR, you're essentially losing out on all the value that that vendor is potentially adding to you, right? And healthcare systems are notorious in terms of their lack of ability to integrate with other systems. So, we over the last, we've been doing this for a lot of years. We've tried to figure out solutions to each one of these challenges. I'm very proud of our, integration work that we do. I think that's the one that I'm focusing on right now. There's different standards that we've leveraged to do so, such as HL7s, the new FHIR standard, APIs, whether it's publishing our own APIs or conforming to, a marketplace like an Athena or an Epic. These are integrations that we've invested in. And then, another thing that I pride ourselves and Infinix on is figuring it out one way or another, right? If there are customers that are unable to do that integration, right? We've come up with a way to do so using bots, right? Bots that can enter information, can extract information from an EMR, enter it into the Infinix system, and vice versa. Let's say customers don't have the ability or the pension to invest in something like that. We support batch bulk uploads of reports from customer systems, right? So I think there's a lot of different things that we've tried to do within this space, within this realm, that have really helped unlock the true value of our offering, right? Which is getting those prior authorization and eligibility benefits quicker, faster, more reliably.
You already kind of touched on the next question and talking about APIs generating, building up our own solution to the problem. What do you envision in the next generation of solutions to help address these challenges?
Yeah, so I think let's talk about the genesis of solutions within uh, patient access revenue cycle management. I think your first solution to some of these problems was picking up the phone and calling the payer. Right? That's the manual approach, right? As I call that step one. Step two was what I'll call more traditional forms of automation, right? Like the clearinghouse automation, so on and so forth. I think where we are right now, where we're headed, and where we will go going forward is a more multimodal form of automation. We call it, say, advanced automation, intelligent automation techniques. And then, of course, really leveraging some of the new breakthroughs in AI and machine learning to get more intelligent around some of these tasks, right? Because as much as we want to automate, there is a gap or a ceiling in terms of what you can fully automate. Beyond that, you have to augment. right? Rather than replace. You have to augment a user's ability to, say, audit cases or perform prior authorizations quicker, faster, smarter, right? And that's where machine learning and AI really comes into play. Um, so I'll quickly give an example of, let's say, a multimodal form of automation, which is how we're helping to solve some of the challenges that I spoke about on the eligibility benefit side of things. So typically, EMR, EHRs, or other vendors just use clearinghouses. What we have done is we've augmented the ability to do that with robotic process automation running on payer portals. So anytime that a clearinghouse is unable to give us the necessary information or any response, we actually have bots that can go against specific payer portals and request information and then extract information and make it available. So that essentially mimicking what a human does, but not requiring a human to do it, right? So really getting creative in terms of how we can leverage technology to solve some of these challenges that face us. And then the intelligence here comes in different forms, right? I think payer portals can change their structure, where they place information, where they have, let's say, yesterday, payer X had their copay coinsurance in a tabular format, but tomorrow they change it, make it without a table, right? So you have to have the intelligence in the bot to be able to recognize that and not falter, right? Be able to say that, hey, I think there's a structural change, but the information that I'm looking for is still here. So let me go ahead and get it. And then I think there's several applications of machine learning and AI that we can talk about. One that we have been using, we've developed and have been using very successfully with a lot of providers for many years, is the ability to automatically or predictively determine whether an authorization is even required or not without checking with the payer, right? So we've been doing prior authorizations for many years for healthcare providers across geographies within the country. So we have a lot of healthy, varied data that we can leverage in terms of outcomes, knowing what kind of requests come in and what the outcomes are, right? And we've leveraged that. We've built proprietary machine learning models, and we see that to almost 99% precision, we can, for a certain percentage of cases, predict whether an authorization is required or not without having to check with the payer. So that's real time. And if you look at what that really means for a provider, it doesn't just mean that you're saving on manual effort to check whether an auth is required or not. You're actually getting a real-time response that says no auth required, which means you don't have to wait to schedule a patient, or you don't have to schedule the patient out X or Y days. You can go ahead and schedule the patient right away.
Yeah, I think that's really helpful when we're looking at not only what the team has to do at the facilities, at the doctor's offices, but having that additional support of technology, to step in to reduce some of that additional manual labor that they're doing. And I think that's what's great about Infinx is we have that balance of both. We've got the technology plus the team to be able to still step in and help support those physicians and facilities where they don't even have the staff to be able to work on anything manually. So I think that's a really great way that Infinix can help our customers and any future customers as well. How do you feel as far as proposing the balance and the need to review patient safety with the goal of minimizing some of that administrative burden and delays in eligibility or prior authorization?
I mean, why are we doing any of this, right? I think, especially from a provider's point of view, is so that you can maximize the patient-related applications and metrics, right? You want to make sure patient safety is of primary importance. You want to make sure patient experience is of primary importance. You want to make sure that when a patient comes in to see a physician, 80% of their experience is not without the physician, right? And then 20%, it should be the other way around. You shouldn't spend 80% of your time waiting, filling in forms, waiting for the provider to check your eligibility, waiting for prior authorization to be obtained. You want to maximize patients' time with the physician. You want to maximize the clinical aspect
Mhm.
of these experiences. So I think that's why it's so important that the burden of the administrative challenges be offloaded, right? So that like in any business or any entity, right? So the providers can focus on their core competencies, right, which is patient care, and have the administrative challenges and burdens be dealt with the entities that are experts in doing those things. So I think that's what we're trying to do here, which is helping providers just focus more on patients, right? So using more technology, having vendor support in automating your patient access administrative processes, your back-end revenue cycle processes, such as coding, accounts receivables, so on and so forth, really gives you a lot more time on your hands, right? So that opportunity cost that we talked about before of your resources, spending on chasing authorizations or, performing other tasks can be reutilized, reoptimized into more productive tasks that you have.
Yeah, I was talking to a physician's office earlier this week, and their current ability to do prior authorizations, even with the technology vendor that they have, they're not starting some of those prior authorizations for 20 plus days out. And, I
Wow.
was talking to her about how, we like to start them within the first 24 hours, 48 hours.
Mhm.
Why wait? Especially if prior authorization isn't required, they can get that patient in quicker, faster, and treatment, and again, revenue in the door. So I think that's really important to also think about. It's not just the administrative burden, but it's the timing in which, getting this information faster, real time as much as possible with the technology to help manage and schedule patients so much better.
Yeah, absolutely. And then, you're saving time, but on uh, the percentage of cases where you do still need some clinical expertise or human expertise, you're leveraging technologies out there like the machine learning AI capabilities to be better, to help augment you, right? So that you reduce human error rates, you're able to be more productive, increase your throughput. So that's equally, I think, valuable.
Agreed. Agreed. Um, I thank you very much. Is there anything else you'd like to share with the team and any future endeavors that we might be doing here at Infinx?
No, I think if any of this, makes sense or resonates with you, you want to learn more about what's going on, feel free to reach out to Melissa, and we're happy to have a one-on-one session.
Absolutely. Thank you for that. Everyone, we appreciate your time and your contribution to today's office hours. We will host another one at the same time next week. Looking forward to seeing you again, and thank you again, Aakash.
My pleasure. Thank
Bye-bye,
you.
everybody.
Bye.